Those of you, again, I'm Kim Dodson. I'm the CEO for the ARC of Indiana. I'm going to start just a little bit at the federal level, not because it's the easiest place, but just because it's I don't know, in the forefront of my mind. You all probably have seen that last week the House of Representatives passed a bill that called on an $880 billion cut to programs, including Medicaid, over the next 10 years. So what I have, as I've been talking to people, and I'm kind of tired of this phrase, of people saying it's not our intent, right? So legislators, people in DC are telling me, Kim, it's not our intent to damage Medicaid for people with intellectual and developmental disabilities. But then when I talk to them about what they're trying to do, I don't think they understand sometimes the unintended consequences of some of their actions. And I think that's what we have to be able to talk to them about, and again, share our stories about how important Medicaid is to people with disabilities and those we care about. So $880 billion over a decade. That's just a lot of money, right? And yes, there's a lot of conversation around making sure that Medicaid is sustainable financially. Yes, of course, right? We want that. We want to make sure that there's not fraud. Yes, of course. They're weighing in on trying to, rein in that fraud and abuse. We do want that, right? But again, we just want it done in a smart way that doesn't have these unintended consequences. And it's done, quite honestly, in a slow and thoughtful way. I again have been talking to people about these knee-jerk reactions of making all of these changes without the data, right? Let's know some of the information of whatever issue it is you're trying to resolve. Let's get the data so that we know that whatever solution you're putting in place is actually going to take care of the issue you're trying to resolve. And it's getting very mixed results, because some people just think we need to act fast. If we make errors, we'll correct them. I don't know about you, but I've been doing this long enough that I know that correcting errors takes a long, long time. And when you're talking specifically around Medicaid and people's lives, that's extremely dangerous, right? Because as people lose services or lose access to important prescriptions or whatever else, their lives are going to be impacted in a very detrimental way. So I think we need to be concerned about that. Before I move off from the federal level, I would just say we are really trying to get anyone and everyone to contact your local congressperson and our 2 senators. And just even do a letter of introduction. It does not have to be deep in detail at all whatsoever. A simple, email to your congressperson that just says, hi, this is who you are. This is why you care about Medicaid. So whatever that personal paragraph is, right? You have a son, daughter, you work at a clinic that provides services. All of those voices are extremely important. Do that and just say, I want to be a resource to you. As Medicaid continues to have these deep conversations over the next few months and even years, please know that I am a resource for you in your area. If you want to meet somebody who utilizes these services, I can make that connection. If you want to understand really how this program works, I can be a resource to you. Most legislators, and this is more so at the state level than DC, are looking for resources in their local community. So if you put yourself out there as the expert and a resource, you could very well start engaging in that type of a conversation and relationship with your lawmaker. And that is just really important and needs to be done. I'm going to change now to just the climate that we're in the State House. A little different, but not very much. It's still very much changing on a day-to-day basis. We were really glad that the budget, as it passed out of the House of Representatives last week, or a week ago or 2 weeks ago, did include fully funding Medicaid in the forecast in which it's supposed to grow over the next 2 years. So it's about a 6.7% increase is what is predicted for Medicaid over the next 2 years. And Governor Braun's budget asked for that to be funded, and the House of Representatives passed a budget with that Medicaid. It did not include anything around the Medicaid waiver waiting list, unfortunately, though. So right now we have about 19,000 people who are on waiting lists for Medicaid waivers. So that's all of the waivers other than the CIH waiver and the TBI waiver. Medicaid waivers are optional services under the Medicaid program. So Medicaid is an entitlement program for some populations, but home and community-based services, and specifically the waivers, are an optional services, which means the federal government could choose not to do them. So they could choose to end Medicaid waivers. Our state of Indiana could choose to end Medicaid waivers. And the state for a second, I do want to talk specifically about some legislation going through. Certainly one of the things that I think you guys would be most interested with and probably very aware of is the conversation that had been taking place around ABA services. So does everybody know about that conversation that's been taking place? We've been paying attention to that really since December of 2024. So that was when we went to a state budget committee, and the Secretary of FSSA, or the Medicaid director at that time, talked about their interest and their moving forward with a Medicaid state plan amendment to the federal government that would limit ABA services to no more than 30 hours per week and a retroactive lifetime cap of 36 months. All of those can be appealed, and you can get more hours if you prove that you need more. So there is a process in place for that. FSSA felt very strongly to get the program under financial constraints, that they still did need a 36-month cap, but they very much reacted the same way of it cannot be retroactive. And we are closely watching several pieces of legislation. House Bill 1689 is a bill that we are spearheading. It very much deals with Medicaid as it was changed in 2024, specifically around medically complex people, both children and adults. Again, a lot of the changes that came out of that $1 billion shortfall on Medicaid was, again, how I describe knee-jerk reactions, right? Let's make a change because we see this as an area, not really understanding the full result of some of those changes. We're really wanting a more transparent process, both on the health and wellness waiver and on extraordinary care given to, again, those medically complex people. We think that, as the state is working on more waiver language, both in the family support waiver, the health and wellness waiver, the CIH waiver, we want to make sure we have a good definition of extraordinary care. We want to make sure that we have a good definition for structured family caregiving. We want to make sure that structured family caregiving is used and used appropriately for the people that it's intended to serve. Other pieces of legislation is around special education. This is House Bill 1285. This is, I think, for the last 2 years, it's been known as the camera bill. Cameras in classrooms has really gotten a lot of pushback. However, I will say this year specifically, the people who represent the schools are not arguing about the policy. They have really stepped away from arguing that teachers don't want to be on cameras. They are really focused on the cost and the cost that it would take to put cameras in classrooms. The bill does state that, when a student passes away, and or leaves a school, that the family is given, an opportunity to go in to clean out those belongings themselves. It has access to those personal belongings, and the school just doesn't throw them away, and the parent doesn't have access to them. Senate Bill 2 is another bill. This bill is a lot wrapped up into one. So this is the bill that the state is using to rein in some Medicaid cost around the Healthy Indiana program, and really this is what you're seeing on the news around people who are capable of working in and on Medicaid should be forced to work. So this is the bill that is putting forth the idea about work requirements to continue to remain on Medicaid. This is the program that cuts and eliminates about 180,000 people off of that program. This is the program that puts some things in place for hospitals to access some fees that hospitals are paying. This is also the bill that tells us as the ARC of Indiana, and I'm sure many of you who work with organizations, that you can no longer advertise or market Medicaid.